happens when patients are in ICU, but she was absolutely still. There really just was no reason for her heart rate to go as high as it did. It was got up to, I think, 172, which if you go and run or do any kind of aerobic activity, your heart rate might get up to 150. So imagine a patient laying there absolutely still and their heart rate gets up to 172. That's very high. It's alarming. And then this morning it was high again when they try to take the tube out. Of course, she is sedated, so not very responsive. They have tried to take her off this ventilator 3 times. The third time mostly because she's been trying to push it out with her tongue. And so she's just been very, very combative with this ventilator. But she's edemic. Edemic, which means that she's very swollen. She's bloated. Her stomach is huge. Her arms and her hands are very swollen, and just it's almost like her skin can just seep fluid. So the goal right now, regardless of whether she has some systemic illness like lupus, the goal right now is to get the fluids out. When you lose fluid, you lose potassium, which she's already low on. You lose proteins, which she's already low on. So they did a high protein therapy on her to bring her, they did a high potassium therapy on her to bring her potassium levels way up, so that when she lost the fluid via diuretics, her body would be okay. Well, when they started the diuretics, her potassium was still very low. She lost a lot of potassium, which means that her body is not absorbing what they're giving her via IV. So the next option that they wanted to do was to give her body nutrients via a tube straight into her stomach, which now that they've been listening, and over, I guess, the course of these past few days, there's been a lot more activity in the gut, in the intestinal area, and the bowel. So they believe that if they can get this tube in there and give her nutrients like that, like we're used to taking in nutrients, that her stomach can absorb it and transfer it out into the body. They're doing it via IV. They're giving her the fluids, the saline, the it's TPN, I think is what it's called. It's something that they order and they give it to you via IV. For some reason, her body simply isn't absorbing it. So they have to go another route. They have to get the fluids out of her body. The fluids are creating pressure on her lungs. She has pneumonia. The pressure on her lungs when they take out that tube is going to make the breathing that much harder for her, and her lungs are going to be working overtime, which means that her kidneys are going to be working overtime, and that's all the major organs. When one major organ has to work, they tries to push off that workload onto the other major organs. She has already been into renal failure, and they got her out of that. There are a myriad of issues going on, and it's a big question mark as to why did a gastroenteritis patient end up in ICU and we can't get her well again. But at this point, even if they tested her positive, which she did come back with a high ANA factor, which indicates that she has some sort of autoimmune deficiency going on. Even if they know that without a shadow of a doubt, they've got to get her body well enough for it to help itself, because it's attacking itself. Which I know sounds ironic, I guess. So that's where we're at. If they can't help her body get well, if they can't help her body help itself, then she gets progressively worse and she doesn't leave. But they are confident that if we can get this tube down and allow her body to function naturally and absorb these nutrients, then they can do the diuretics again, release the fluids, and then they have a good chance of getting her off this breathing machine. They get her off the breathing machine, her body starts coming back to its normal state. She's very sedated right now because she's on this breathing machine. So the body isn't responding like it should. Tomorrow morning, I get her medical records from her internal medicine doctor that she was being treated by in College Station. And that way maybe they can at least say, yes, she is lupus positive and we have these results. They're not consulting with a specialist like a rheumatologist or a gastroenterologist. These are ICU doctors. They have a very limited amount of information as far as, you know, what's going on with her. And so they're treating her symptoms versus her systemic illness. But regardless, they have to get her to a point. They can't treat the systemic illness because she is so sick. I wish I had definite answers and better news, but that's where we're at. So we'll see what happens within the next 24 hours. I'll talk to you later.